Good afternoon. My name is Bonnie Burke. I'm a chiropractor with The Wellness Way. What do you do?
Nice to meet you. I'm Ryan. I'm a PA. I work for Pinnacle Orthopedics, and I do surgery, and I specialize in upper extremity.
Wonderful. So I actually have a patient I'd like to talk with you today about, a patient that has pretty severe cervical neck pain. And I just kind of wanted to get your opinions and see what you think about my patient.
Of course.
So my patient came in and she is an 83-year-old woman, and we've been adjusting her for a while and her neck pain just isn't getting better. She's got some radicular symptoms that are going down into her arms and into the first 3 fingers of her hands. We've been doing chiropractic adjustments for so long, but we don't seem to be making much progress, and I'm not sure where to go from there.
Okay, so I guess my first question would be, what do her x-rays look like?
Her x-rays are pretty degenerative. She's got a lot of degeneration. She also has a history of rheumatoid arthritis, so she does have some pretty decent degeneration in her cervical spine and in her hands as well.
Okay, and how long has the radicular symptoms been going on? Has it progressed, or has it only been going on a few weeks?
It's only been going on a few weeks, but it does seem to be getting a little bit worse every time I see her.
Okay, and what has she tried so far other than chiropractic care?
We have tried a couple of injections. So she did the cervical block injections, and we've been doing exercises and stuff like that. She's tried medicines, but medicines don't help, like NSAIDs and stuff like that. But I'm not sure what else she's tried 100%.
Okay, and is most of it pain? Is it pain from the radicular symptoms she's having, or is it mostly pain that's coming from her neck, you think?
I think most of it's coming from her neck, but the radicular symptoms are making it a lot worse.
Okay, and how has she said anything about her grip in terms of losing grip or dexterity?
She mentioned that she feels weak, but she didn't mention that she was having trouble with grip, but because of her weakness, she is having trouble holding on to things for long periods of time.
So it's affecting her quality of life. So it's coming from her neck, but she's having other symptoms that are affecting her quality of life. So, approach I would take, obviously we'd get an x-ray. And obviously I haven't seen the x-ray, but you're telling me it's degenerative. Okay, and how old is this patient?
83.
83. So again, we expect those sort of changes. So, we're not going to get rid of the arthritis, as you know, right? So, the first steps are kind of doing PT, right? Doing topicals. The route we would take is we'd say, oh, hey, a Voltaren gel, a Blue Emu, a Biofreeze, and then doing the exercise to get her long-term relief. And then with the radicular symptoms, we'd start conservatively, and, we'd go to some sort of bracing. So depending on what fingers is she having it in? Or
it's her first 3 fingers.
First 3 fingers, so thumb, index, middle.
Yes.
Okay, so again, it sounds like carpal tunnel, right? So we'd start with wrist cock-up bracing, essentially to keep that, right? And has she done any of that?
I don't think she actually has. I have done a little bit of KT taping on her shoulder and her wrist. But other than that, and she said that helped a little bit, but the relief was so temporary, it didn't seem to help that much.
Right. So, the next step we want to do is, okay, well, it's only been going on a few weeks, but we're losing grip now. Is she having any first dorsal interossei wasting, thenar atrophy, anything like that you've noticed?
Just a little bit, not a ton. It's just a little, her thenar pad is a little bit atrophied compared to her left side, but not that much.
And she's right-handed?
Yes.
Okay, so the biggest thing we worry about, as you know, is once that wasting happens, there's no getting it back, right? We can only keep it from getting worse. So we could try the wrist cock-up bracing. We could take that approach if it's only been going on a few weeks, but if this has been a chronic thing that's been going on, our next step, usually what we do is we get an EMG. Essentially, EMG, nerve conduction study, where we're looking at the cervicals, we're looking at the conduction across the elbow, across the wrist, to essentially say, okay, well, is it coming from higher up, or is it maybe coming from the median nerve, from that ulnar nerve? That doesn't mean it's not coming from both, but that's the approach we like to take, because then we go, okay, well, if your cervicals are fine, maybe you still have some degeneration up there, but if across your wrist or across your elbow isn't conducting right, then that could be causing a lot of her symptoms.
How do you know that the EMG symptoms aren't 100% coming from the cervicals and you're just getting a secondary slight pressure on the lower extremity.
I mean, you could be getting a double crush syndrome, absolutely, but and especially if she's complaining of neck pain up here, but it doesn't take away from the atrophies she's getting here. Even if she is having double crush syndrome and say it's coming from her cervicals, this is only going to continue to waste if something isn't done about this. And that doesn't mean she has to, but I think she has to be informed and say, you don't have to do surgery, and based on your AMG studies, we'll talk about it, but I think it's something she can possibly consider, especially if she's having wasting there already.
And these types of surgeries on an 83-year-old are safe and effective?
I mean, it depends on her background and, what sort of medications she's taking, but usually, carpal cubital tunnel surgery is pretty straightforward. Usually anyone over 65 we do in the hospital, and we get primary care clearance just to make sure everything looks good, especially someone that age. But again, it comes down to quality of life. She didn't have any wasting and it wasn't affecting her. We'd say, well, look, we could go and try injections to see diagnostically how that feels for them, because I tell people, give the injection a month. That's essentially going to mimic how the surgery is going to be. So if they're kind of on the border, I say, well, let's get the injection, have you come back in a month, because we can't do it any sooner than that due to the increased risk of infection, right? And if you don't see great results, then okay, well, let's seek out alternative treatment, right? Because it's not worth having the surgery if it doesn't give you relief. So, and that's what we inform our patients on, and you can only give them the facts, but they have to ultimately make that decision for themselves.
Yeah, this was very helpful. I will definitely talk with my patient and see what she's thinking, and we'll do some referrals and get her out to do some more studies.
Awesome. Well, wonderful talking to you.
Thank you so much for your time.
No problem.